Hey, Dr. Shakib here from Irvine Spinal Wellness Center. I am here with Lisa. We did a couple of videos actually. Lisa sharing with us her story and her thought on the brain-based neurology and posture and developmental kinesiology type of examination that she received with the history of headaches, lower back pain, and stroke on the left side of her body that essentially brought her to the practice. So with Lisa, I don't do diversified adjustment, which is typically what people know as the kind of adjustment they receive in a chiropractic office. We have modified it. There is some degree of mobilization with Lisa, with her neck, that we do to introduce more movement and take away some of the, not so much taking away some of the scar tissue, but certainly limit the amount of scar tissue buildup as a result of lack of movement. By the time I saw Lisa, she had the history of stroke. When was your stroke?
July of 2017.
2017, and this is 2019, so we can see that things add up. So we have that against us, but certainly not stopping us from progressing. So this video is gonna essentially show you some of the things I have been doing with Lisa. She does suffer from headaches. So one of the things that she has had to do as a result of your stroke and the fact that she needed to move around is she uses her upper trap and not just upper trap, a lot of the neck, anterior and posterior, front and back of the neck and upper back area to really lift herself up. So a lot of times what we do here is we do some of the functional rehab movement type exercises like treatment like ART, active release technique in her case, and then obviously there's a modified adjustment that I do, and then we go out in the front at the gym and we do brain-based neurology exercises, and at this point we're doing some of the simple movements, developmental movements, to kind of give her the necessary core so we can proceed with the rest of the treatment. The treatment plan for Lisa is going beautifully. It's going faster than I thought it would, which is fantastic, but a tiny bit slower because of the stroke. We have some going back and kind of revisiting some of the things that, generally speaking, for non-stroke patients, we don't worry about because it's absent. Do you have anything to say here, Lisa?
Lisa is pretty good.
I know that you had seen chiropractors before.
Yes.
And you probably were getting the diversified manual adjustment.
Yes, quick.
Crack,
Crack, and on your way, yeah.
Right. So how long is your visits typically here, short of all the chit-chatting we do?
Anywhere from maybe an hour or less, right?
Yeah. About an hour.
45 minutes.
It all depends on what we're doing.
Right.
One thing I definitely don't want to do is to rush it or cut the visit short because I'm in a hurry.
Right.
I'm in no hurry.
You never do that.
And I'm grateful for that. So I hope I'm not going to cut my own. I'm going to have to kind of stand a little wider than usual just so I don't cut my head.
You want me to duck down?
No, you just be yourself.
Okay.
So you're going to get to see some of the, can you scoot this way so you're
sure.
centralized?
Right there? Okay.
Yes. So we're going to be doing some of the things that we do before starting to do the active rehab. So let's go ahead and elongate your spine. No, don't use your scapula.
Okay.
Just elongate, so as if I've got a magnet up here to elongate your spine, nice and relaxed. Can you activate this muscle without using your elbows? Can you press into my hand here, my finger here? Go ahead and activate. Very nice. Hold it there. activate, and very good. Drop that. Go back here. Go back to neutral. Lisa did not use the right muscle to make the move, so I'm breaking the wrong habit of movement. That's very, very important. Look nice and straight ahead. Go ahead and press into my finger, just using, no, not initiated here. It's a scapular movement, so go ahead and press into that. Very nice. Hold it there. Glide your neck back. Glide it back in that fashion and hold it there. With this being where it's at, can you press against my finger? Bring it up. Bring it up more, more, more. Hold it and bring your shoulder down. So these are the things. I'm not going to videotape the whole treatment, but that's a little mini sneak peek view of what we have to do with Lisa to kind of, I call it, what, touch and tell. So we do that to make sure that there is like a refresher for the brain. This is not typically what I do for everyone, but with Lisa, because of the history of stroke, it's always nice and helpful to remind the brain what we're after, and then we proceed with the rest of the care. This part of the treatment is not brain-based neurology, but it's what is needed to activate her and set her on the right track for what happens outside. Anyway, I hope that this helps you and makes you better understand what happens in my practice, and that everyone's special, everyone's story is their story, and no two people are the same.
Thank you.
Thank you.
Thank you.